Hello, everyone. Today we will talk about developmental milestones in babies during the third month. If you have ever looked at pregnancy-related resources, you may have come across information about trimesters. You might have heard statements like, "This happens in the first trimester," or "That happens in the second trimester." In fact, the first 3 months after birth are also described in medical literature as the fourth trimester of pregnancy. Let me start with some good news. From this month onward, your baby can sleep through the night. Sleeping for 7 to 9 hours does not cause any metabolic problems. So if your baby does not wake up, you can safely let them continue sleeping. To briefly summarize what you should know during this period, your baby can sleep through the night without any problems. This is also one of the periods when babies are exposed to a higher risk of trauma, although babies cannot move independently yet. If the surface they are placed on is not secure, the risk of falling increases starting from this month. During this period, babies may discover their hands and fingers and may want to suck on them. This is completely normal and actually a desired developmental behavior, so there is no need to worry. I would also like to remind you of the recommendation of the American Academy of Pediatrics. Your baby should ideally sleep in the same room, but in a separate bed for at least the first 6 months, preferably up to 1 year. At 3 months of age, your pediatrician is most likely already monitoring your baby's growth percentiles. Every baby has their own individual growth pattern, which appears as a curve, and at least 2 or 3 measurements are required to evaluate it properly. If there is anything abnormal, your doctor will inform you. For this reason, do not focus too much on weight or height numbers. Instead, focus on developmental milestones and what you may encounter at home. If you would like to access our videos as early as possible, don't forget to subscribe to our YouTube channel and turn on notifications by clicking the bell icon. In terms of physical development, by the third month, babies discover their fingers and can bring their hands together at the midline and then to their mouth. Finger and hand sucking is a healthy developmental step and represents the first stage of self-feeding. In later stages, this will prepare your baby for baby-led weaning and self-feeding during the complementary feeding period. Your baby's sense of smell is now well developed, and they can recognize the scent of their caregiver, whether that is their mother or father, and feel calmer in their presence. The sense of touch is also significantly developed during this period. While babies previously showed more sucking-related behaviors, they now begin to show tactile preferences, meaning they prefer softer and more comfortable textures and try to avoid things that make them uncomfortable. We previously mentioned that by the second month, babies start to develop head control. By the third month, babies can lift their head up to 90 degrees while lying on their stomach and observe their surroundings. In simple terms, when placed on their tummy, your baby can lift their head and look around comfortably. One of the most frequently asked questions during this period is about supported sitting. By this month, babies have sufficient head control and can track objects through 180 degrees. You can now hold your baby in a supported sitting position on your lap. I want to emphasize that this is supported sitting only. Unsupported sitting is still not appropriate. During this period, your baby's leg strength also improves. By gently holding your baby's arms and slowly pulling them upward, you can get an idea of how much support they provide with their legs. Many pediatricians use this method during routine examinations to assess development. You can safely do this at home as a simple exercise to help strengthen your baby's legs. We also talked about tummy time before, and it remains extremely important. Tummy time helps strengthen the arms, legs, abdominal muscles, back muscles, neck muscles, and also supports brain development. At this stage, babies can support themselves on their arms while lying on their stomach, almost like a small strength demonstration. In terms of brain and sensory development, at birth, babies have a clear visual range of about 30 centimeters. Over time, this increases, and by the third month, babies can clearly see objects at a distance of approximately 20 to 40 centimeters. Although visual focus has improved, depth perception has not fully developed yet, so babies cannot accurately judge whether an object is near or far. Hearing is also well developed at this stage. Babies respond to loud voices and may try to imitate sounds you make. Since they are aware of their hands and can bring them to the midline and mouth, they can now grasp simple objects like rattles and begin to play with them. Object tracking has improved significantly, and babies can now follow an object through a 180-degree range. Eye crossing, which may be normal in earlier months, should no longer be present after this age. It is important to remember that every baby is different. Developmental milestones represent a range, not strict rules. Some babies may achieve certain skills earlier, while others may take a little longer. However, if your baby is not gaining weight properly, is losing growth percentile, does not make eye contact, does not track objects, or still has persistent eye crossing after the third month, you should consult your pediatrician and, if necessary, a pediatric ophthalmologist. If you notice any concerning delays in physical or neurological development, it is also important to seek medical evaluation. A typical day for a 3-month-old baby includes many opportunities to support communication and language development. According to the American Academy of Pediatrics, simple daily activities can significantly influence language development. Talk to your baby, read books, and sing songs. During diaper changes, try to describe what you are doing. Sometimes imitate the sounds your baby makes a surprise and engage them. When your baby vocalizes or tries to communicate, react enthusiastically by smiling, widening your eyes, clapping your hands, and showing excitement. This helps your baby understand that communication is meaningful. Screen exposure is not recommended during the first 18 months of life. Communication requires mutual interaction, where one side responds to the other. Passive exposure to television, tablets, or phones negatively affects social and language development. If screen use is unavoidable, the content should include active verbal interaction. But whenever possible, try to keep your baby away from screens entirely. In terms of baby care, one of the most important principles is to touch less and observe more. By observing your baby carefully, you can understand their needs better without unnecessary intervention. Your baby's stool can provide important information about their digestive health. Yellow, seedy, odorless stool is normal in breastfed babies. Green stool can also be normal unless it has a strong, foul odor. However, if you notice bright red blood, black stool without iron supplementation, or pale white or gray stool, these are abnormal findings and require immediate medical evaluation. Although teething typically starts after 6 months, early signs may appear from the 3rd month. These include increased drooling, mild irritability, restlessness, and slight increases in body temperature up to 37.8 degrees Celsius. Teething does not cause fever above 38 degrees. If your baby's temperature exceeds this level, you should uncover them, wait for a short period, recheck the temperature, and consult your doctor if it remains high. For accurate fever measurement, avoid infrared forehead thermometers. Ear thermometers or digital thermometers are more reliable. Regarding feeding, continue exactly as you've been doing. If your baby is exclusively breastfed, continue breastfeeding without giving water. If you are using formula, continue with stage 1 formula. If you are using both breast milk and formula, there is still no need to give water. Your pediatrician will evaluate whether feeding is adequate based on growth and development. From a sleep perspective, babies at this age can safely sleep through the night. Night sleep may range from 7 to 9 hours, with additional daytime naps adding up to a total of 12 to 14 hours of sleep per day. Avoid intentionally delaying sleep to shift wake-up times, as overtired babies tend to sleep worse, not better. When you notice signs of sleep readiness, such as eye rubbing, fussiness, or seeking comfort despite being well-fed, it is best to follow your established sleep routine. Finally, in terms of safety, babies are now stronger and more mobile. Always make sure your baby is securely placed when carrying or setting them down. Ensure that baby carriers are properly fastened and that surfaces are stable. In the United States, approximately 24,000 babies are taken to emergency rooms each year due to falls related to unsafe placement. Always act as if you're still holding your baby, even after placing them down. I will be completing the 4th and 5th month videos soon. If you haven't watched the previous videos, I recommend doing so, as developmental milestones are part of a continuous process. Take care and see you soon.